We're here at UPMC Susquehanna, and joining us now we have Dr. David Rilling, the Chief of Surgery at Lock Haven Hospital. Thanks for being with us.
Thank you. Thanks for having me.
So one of the things patients hate hearing is they're going to need surgery. So we're talking about some tips to overcome the fear of that. What tips do you have for them?
Well, it's interesting because yesterday when I was sitting in the barber shop having my hair cut, I was thinking about this topic because barbers used to be surgeons hundreds of years ago.
Oh, wow.
They were called barber surgeons. They did haircuts, but they also did surgical procedures. One of them was bloodletting, and thus the color red and white on the barber poles. And in fact, bloodletting was a very common surgical procedure. In fact, George Washington died from too much bloodletting.
So basically, don't be afraid of surgery. It's just like getting your hair cut. Is that what you're saying?
Yeah, yeah. Although when I was a little kid, I'm sure I was pretty anxious, but not anymore.
Right. Yeah, a lot of times, going into surgery, it's a mental game. So what do you have to say to people to prepare mentally for going into surgery?
Yeah, I totally understand the fear and anxiety, and even doctors and nurses and providers of medical care have anxiety and fear when they go into procedures. But I think our fear is a little bit less because we have knowledge of what's happening, of what's behind the scenes. And I think once patients understand that and they're walked through the process, that it reduces their anxiety quite a bit.
Exactly. It's basically fear of the unknown.
Right.
So if a patient talks with their doctor and understands what's going to happen, they'll feel a lot better. So what can people expect if they're going into surgery?
Well, I think the entire role of a medical system, and UPMC in particular, which is one of the finest in the country, is patient-centered. In other words, our goal, every one of us that work in the system, our goal is to reduce the patient's fears and to make them as comfortable and safe with the highest quality as possible. And we do that from the time the patient goes to their family doctor to the time that they're in the post-op recovery room waking up from surgery. So every one of those steps is explained. When a patient goes to my office, for instance, I explain the procedure to them. I often will use a booklet such as this, laparoscopic gallbladder surgery, hernia surgery, and go through the entire process with all the possible complications and the reasons for the surgery. So I think that helps to allay their fears. Once they walk into the hospital, everyone there is highly trained. They're the best, and they're experts. From the time they walk into the reception area to the time that they go to the preoperative area, through to the OR, and then into the recovery area afterwards.
Right. So it's always a good idea if you do have some fears, some concerns, ask questions. That's what the doctors are there to help ease your fears. Doctor, thanks so much for your time today.
Oh, you're welcome.
If you have any more questions, just go to upmcsusquehanna.org.